Question 1. Which of the following best describes the primary purpose of a functional analysis in applied behavior analysis, ABA? A. To identify a client's preferred reinforcers for skill acquisition. B. To determine the form of a behavior and how often it occurs. C. To systematically manipulate environmental variables to identify the function of a challenging behavior. D. To teach new, appropriate behaviors to replace maladaptive ones. Answer: C. To systematically manipulate environmental variables to identify the function of a challenging behavior. This question targets your understanding of functional analysis, a key component in behavioral assessment. The phrase primary purpose directs you to the core reason for conducting this type of assessment. A functional analysis involves directly testing different conditions, example attention, escape, tangible, automatic, to see which environmental variable reliably produces or maintains a challenging behavior, thereby pinpointing its function. For example, if a child's hitting behavior increases consistently only when staff attention is withdrawn, it suggests attention is the maintaining function. Remember that the goal is always to discover why a behavior is happening, not just what it looks like or how often it occurs. Question 2. A behavior analyst is conducting a multiple stimulus without replacement, MSWO, preference assessment. If a client consistently chooses a toy car first, then a puzzle second, and a book third across multiple trials, what does this assessment primarily reveal? A. The client's skill acquisition rate. B. A hierarchy of the client's preferences. C. The automatic function of toy play. D. The client's ability to discriminate between stimuli. Answer: B. A hierarchy of the client's preferences. This question assesses your knowledge of preference assessments, specifically the MSWO method. The keywords consistently chooses and across multiple trials highlight that the assessment reveals stable patterns of choice. A multiple stimulus without replacement assessment systematically presents items, removing chosen ones after each selection, which allows for the creation of a clear rank order from most preferred to least preferred among the presented items. For example, if a child always picks a certain snack over others when offered, this assessment helps to determine that snack's high reinforcing value relative to the others. This structured approach helps ensure that the most potent motivators are identified for use in intervention. Question 3. A BCBA wants to decrease a client's yelling behavior in the classroom. They decide that every time the client yells, the teacher will immediately remove all attention, example eye contact, verbal reprimands, for 30 seconds. This intervention is an example of which behavioral procedure? A. Positive reinforcement. B. Negative reinforcement. C. Extinction. D. Response cost. Answer: C. Extinction. This question is about understanding extinction, a fundamental principle of behavior analysis. The core clue is remove all attention immediately following the yelling behavior, indicating that the previously reinforced behavior, yelling, presumably for attention, is no longer producing that reinforcement. Extinction involves withholding reinforcement for a previously reinforced behavior, leading to a decrease in that behavior over time. For instance, if a child used to cry to get a toy and now crying no longer results in the toy, the crying behavior will likely decrease. Always remember that extinction specifically involves withholding the reinforcer that was previously maintaining the behavior. Question 4. A client has learned to request, for water when thirsty. The BCBA now wants the client to generalize this to different people and in different settings. Which strategy would be most appropriate for promoting this generalization? A. Only allow the client to for water with the BCBA in the therapy room. B. Prompt the client to mand for water when not thirsty. C. Have the client mand for water with various caregivers in different rooms and even outside. D. Immediately provide a different drink, like juice, when the client mands for water. Answer: C. Have the client mand for water with various caregivers in different rooms and even outside. This question tests your understanding of generalization, a critical concept in ensuring skills are useful beyond the initial teaching environment. The keyword generalize directly points to the need for the behavior to occur across different people, places, and situations. To promote generalization, it is important to teach skills in multiple settings and with multiple instructors, also known as programming for generalization. For example, if a child learns to share with one friend, practicing sharing with other friends in different play settings helps them generalize the skill. Remember that true learning means a skill is applied broadly, not just in specific, controlled conditions. Question 5. Which of the following is the best example of a permanent product measurement? A. Counting the number of completed math problems on a worksheet. B. Timing how long a child engages in a tantrum. C. Observing and tallying instances of hand flapping during free play. D. Recording the latency from a prompt to the start of a response. Answer: A. Counting the number of completed math problems on a worksheet. This question assesses your understanding of permanent product measurement, a method of data collection. The key clue is permanent product, which refers to the tangible, observable outcome of a behavior that lasts after the behavior itself has ended. Counting completed math problems is a direct measurement of the result of the behavior, doing math problems, that can be observed later without needing to be present when the behavior occurs. In contrast, timing tantrums or tallying hand flapping are direct observations of the behavior as it happens. For instance, measuring how many cookies were baked from a recipe is another permanent product measurement, as the cookies themselves are the lasting outcome. This method is often convenient as it doesn't require constant observation. Question 6. A child often screams loudly when asked to transition from playing to doing schoolwork. The BCBA hypothesizes this behavior serves an escape function. What would be the most appropriate intervention based on this hypothesis? A. Providing a preferred toy immediately after the child screams. B. Allowing the child to avoid schoolwork when they scream. C. Prompting the child to use a break card to request a short break before screaming. D. Ignoring the screaming behavior and continuing to present the demand. Answer: C. Prompting the child to use a break card to request a short break before screaming. This question tests your ability to select an appropriate intervention based on a hypothesized behavior function. The clue escape function indicates the child is trying to avoid or get away from a non-preferred task. A functional-based intervention for escape-maintained behavior often involves teaching an appropriate alternative behavior that achieves the same function, example getting a break, but in a socially acceptable way. Teaching a break card allows the child to appropriately request a break, thereby achieving escape without screaming. Ignoring the screaming, extinction, might be part of the plan, but teaching an alternative behavior is often more effective and ethical. Think of it this way: replace the problem behavior with a good behavior that serves the same purpose. Question 7. Which of the following scenarios best illustrates negative reinforcement? A. A student completes their homework to earn extra free time. B. A child screams, and their parent gives them a candy to stop the screaming. C. A person takes an aspirin to relieve a headache, and is more likely to take aspirin in the future for headaches. D. A dog receives a treat for sitting on command. Answer: C. A person takes an aspirin to relieve a headache, and is more likely to take aspirin in the future for headaches. This question evaluates your understanding of negative reinforcement. The key elements of negative reinforcement are the removal of an aversive stimulus following a behavior, which then increases the future likelihood of that behavior. In this scenario, the headache, aversive stimulus, is removed by taking aspirin, making it more likely the person will take aspirin again when a headache occurs. Option A is positive reinforcement, adding something desirable. Option B is positive reinforcement of screaming, adding candy, and option D is positive reinforcement, adding a treat. Remember, negative reinforcement is about escaping or avoiding something unpleasant, and this makes the behavior happen more often. Question 8. A BCBA is designing an intervention for a client who engages in elopement, running away. They decide to place a door alarm on all exits that sounds whenever the client attempts to open the door, startling them and preventing elopement. This is an example of what type of intervention? A. Response blocking. B. Discriminative stimulus, SD. C. Punishment. D. Antecedent manipulation. Answer D. Antecedent manipulation. This question assesses your knowledge of antecedent-based interventions. The key is that the alarm is placed before the behavior occurs, or as it begins, specifically targeting the environmental conditions that precede elopement. Antecedent manipulation involves changing the environment or events that happen before a behavior occurs to make the challenging behavior less likely or the desired behavior more likely. While the alarm might also function as a punisher by startling the client, its primary design here is to alter the environment, the door, to prevent or signal the attempt, thus it's an antecedent strategy. Think of it as setting up the environment for success or to prevent problems, rather than responding to the behavior after it has fully happened. Question 9. A child is learning to identify farm animals. The therapist shows a picture of a cow and asks, "What is this?" The child says, "Moo." The therapist then says, "Cow." "It's a cow," and immediately gives a sticker. This teaching procedure is an example of what? A. Shaping. B. Prompting. C. Modeling. D. Error correction. Answer D. Error correction. This question examines your understanding of common teaching procedures, specifically error correction. The phrase the child says, "Moo." The therapist then says, "Cow." "It's a cow," indicates that the child made an incorrect response, and the therapist immediately provided the correct answer, often followed by a prompt or representation of the stimulus, and then reinforcement for a correct response. Error correction is a procedure used to address incorrect responses by providing information about the correct response immediately after the error. This helps the learner differentiate between correct and incorrect responses and prevents them from practicing errors. It ensures that the learner gets direct feedback and a chance to respond correctly. Question 10. Which ethical guideline emphasizes the importance of using the least restrictive and most effective interventions? A. Responsibility to clients. B. Professional competence and scope of practice. C. Beneficence and non-maleficence. D. Avoiding multiple relationships. Answer C. Beneficence and non-maleficence. This question tests your knowledge of the core ethical principles in ABA. Beneficence means to do good, and non-maleficence means to do no harm. The guideline of using the least restrictive and most effective interventions directly embodies these principles by ensuring that clients receive interventions that are both helpful, beneficence, and minimize potential negative impacts or unnecessary restrictions, non-maleficence. This ethical standard guides practitioners to choose interventions that maximize client benefit while also being as unintrusive as possible. Always strive for interventions that are both highly effective and respectful of a client's autonomy and dignity. Question 11. A BCBA is teaching a child to brush their teeth. They start by reinforcing the child for picking up the toothbrush, then for putting toothpaste on it, then for brushing one tooth, and so on, until the child brushes their teeth independently. This systematic process is known as A. Chaining, B. Shaping, C. Discrete trial training, DTT, D. Forward chaining. Answer: B. Shaping. This question assesses your understanding of shaping, a fundamental behavioral procedure. The key clue is reinforcing successive approximations toward a target behavior, meaning you reward steps that get closer and closer to the final desired skill. Shaping involves differentially reinforcing behaviors that resemble the target behavior more and more closely, gradually leading the individual to perform the complex skill. While brushing teeth is a chain of behaviors, the process of reinforcing each small step toward the overall action of brushing teeth, from picking up the brush to fully brushing, is shaping. For example, teaching a dog to roll over might start by reinforcing lying down, then lying on its side, then actually rolling. Remember, shaping builds new behaviors by rewarding improvements. Question 12. A BCBA wants to measure the time between the therapist's instruction, touch your nose, and the client's initiation of touching their nose. What dimension of behavior is the BCBA measuring? A. Frequency, B. Duration, C. Latency, D. Interresponse time, IRT. Answer: C. Latency. This question tests your understanding of different dimensions of behavior measurement. The key phrase "time between the therapist's instruction and the client's initiation" directly defines latency. Latency is the time from the onset of a stimulus, like an instruction or cue, to the initiation of the response. Frequency is how often a behavior occurs, duration is how long it lasts, and interresponse time, IRT, is the time between two consecutive instances of the same behavior. For example, if a teacher says, "Start your math worksheet," and a student waits 5 minutes before picking up their pencil, that 5 minutes is the latency. Latency is important for understanding how quickly an individual responds to prompts or instructions. Question 13. A client repeatedly asks repetitive questions. The BCBA determines that these questions are maintained by social attention. To decrease this behavior, the BCBA decides to ignore the questions and only provide attention when the client engages in appropriate conversation. This intervention is an example of A. Differential reinforcement of other behavior, DRO. B. Differential reinforcement of alternative behavior, DRA. C. Differential reinforcement of incompatible behavior, DRI. D. Non-contingent reinforcement, NCR. Answer: B. Differential reinforcement of alternative behavior, DRA. This question assesses your knowledge of differential reinforcement procedures. The core strategy here is to reinforce an appropriate conversation, an alternative behavior, while simultaneously withholding reinforcement for the repetitive questions, the problem behavior. Differential reinforcement of alternative behavior, DRA, involves reinforcing a desired or appropriate behavior that is an alternative to the challenging behavior, while placing the challenging behavior on extinction. This differs from DRO, which reinforces the absence of the behavior for a period, and DRI, which reinforces a behavior that physically cannot occur at the same time as the problem behavior. DRA is powerful because it teaches a functional replacement. Question 14. A BCBA is supervising a new RBT. The RBT is struggling to implement a discrete trial training (DTT) program correctly. The BCBA should primarily focus on which ethical guideline related to supervision? A. Protecting confidentiality. B. Maintaining competence. C. Responsible conduct of behavior analysts. D. Maintaining professional boundaries. Answer: B. Maintaining competence. This question directly relates to the ethical responsibilities of a supervisor. The core issue is the RBTs struggling to implement a program, indicating a lack of skill or proficiency in a specific area. A BCBA's ethical obligation under maintaining competence includes ensuring that those they supervise are competent in their roles and providing the necessary training and support to achieve that competence. It's about ensuring the RBT has the skills to provide effective and ethical services. For example, if an RBT is frequently misdelivering prompts, the BCBA must provide targeted training and feedback to improve that skill. Supervisors are responsible for developing the skills of their supervisors. Question 15. What is the main difference between positive punishment and negative punishment? A. Positive punishment increases behavior, while negative punishment decreases behavior. B. Positive punishment involves adding a stimulus, while negative punishment involves removing a stimulus. C. Positive punishment is always physical, while negative punishment is always timeout. D. Positive punishment is more effective than negative punishment. Answer: B. Positive punishment involves adding a stimulus, while negative punishment involves removing a stimulus. This question tests your understanding of the definitions of positive and negative punishment. The key distinction lies in the operation. Positive means adding a stimulus, and negative means removing a stimulus. Both positive and negative punishment decrease the future probability of a behavior, so option A is incorrect. Option C describes common examples but not defining characteristics, and effectiveness depends on many factors. For example, positive punishment might be a verbal reprimand, adding an aversive sound, while negative punishment might be taking away a toy, removing a preferred item. Remember, positive means adding something and negative means taking something away, regardless of whether it's reinforcement or punishment. Question 16. A child touches a hot stove and gets burned. In the future, the child is less likely to touch the stove. This is an example of A. Automatic reinforcement. B. Automatic punishment. C. Social positive reinforcement. D. Social negative reinforcement. Answer: B. Automatic punishment. This question assesses your understanding of automatically mediated contingencies. The key elements are that the consequence, getting burned, happens directly from the behavior, touching the stove, without the involvement of another person, and the behavior, touching the stove, decreases in the future. Automatic punishment occurs when a behavior produces a consequence that reduces its future probability, and that consequence is a direct, natural outcome of the behavior itself, not mediated by another person. For example, if you eat too much candy and feel sick, you are less likely to eat too much candy in the future due to automatic punishment. Think of it as a consequence that happens by itself. Question 17. Which experimental design is best suited for evaluating the effects of an intervention across multiple participants, settings, or behaviors, without requiring a reversal phase? A. Reversal design, ABAB. B. Multiple baseline design. C. Changing criterion design. D. Multi-element design. Answer B. Multiple baseline design. This question tests your knowledge of different experimental designs used in ABA research. The critical clue is across multiple participants, settings, or behaviors, without requiring a reversal phase. The multiple baseline design demonstrates experimental control by sequentially introducing the intervention across different baselines, showing that the behavior changes only when the intervention is applied to that specific baseline. This design is particularly useful when a reversal, withdrawing the intervention, is not ethical or feasible, such as with severe problem behaviors or newly acquired skills. For example, a multiple baseline design could be used to teach hand washing to 3 different children at different times, showing each child improves only after the intervention begins for them. It's a great choice when you can't or shouldn't go back to baseline. Question 18. An RBT is concerned that a BCBA is asking them to perform tasks outside their scope of competence. What is the RBT's ethical responsibility in this situation? A. To comply with all instructions from their supervisor. B. To discuss their concerns with the BCBA and refuse to perform tasks outside their competence. C. To report the BCBA to the BACB immediately. D. To attempt the tasks to gain experience, even if unsure. Answer B. To discuss their concerns with the BCBA and refuse to perform tasks outside their competence. This question addresses the ethical responsibilities of RBTs and the importance of professional boundaries and competence. The phrase outside their scope of competence is the central ethical concern. RBTs have an ethical obligation to only provide services for which they are qualified and competent. They should communicate their concerns to their supervisor and, if necessary, refuse to engage in practices that are beyond their training or skill set, as this could harm the client. For instance, an RBT should not conduct a functional analysis if they have not been trained or authorized to do so. Remember, competence is not just about what you can do, but what you are qualified and authorized to do. Question 19. A BCBA is tracking the percentage of trials a client responds correctly during a DTT session. If the client responds correctly on 8 out of 10 trials, what is the percentage of correct responses? A. 8%. B. 10%. C. 80%. D. 20%. Answer C. 80%. This question assesses your ability to calculate percentage, a common measurement in ABA. The concept percentage of trials means you're looking at the proportion of correct responses out of the total opportunities, expressed as a part of 100. To calculate this, you divide the number of correct responses, 8, by the total number of trials, 10, and then multiply by 100, 8/10. Asterisk 100 is equal to 0.8 asterisk 100 equals 80%. This type of measurement is frequently used to track skill acquisition and progress in teaching programs. Always remember that percentages represent a part of a whole, scaled to 100. Question 20. A child repeatedly says juice while looking at a juice box. This is an example of what type of verbal operant? A. Manned. B. Tact. C. Echoic. D. Intraverbal. Answer B. Tact. This question tests your knowledge of B.F. Skinner's verbal operants, specifically the tact. The key clue is looking at a juice box, which indicates that the verbal behavior juice is under the control of a nonverbal stimulus in the environment, the juice box. A tact is a verbal operant where a speaker names or identifies objects, actions, or properties in the environment, evoked by a nonverbal stimulus and maintained by generalized conditioned reinforcement, example social praise. If the child said juice because they wanted juice, it would be a mand. Think of a tact as labeling or commenting on something you see, hear, smell, taste, or feel. Question 21. Which of the following best describes the principle of parsimony in ABA? A. Explanations for phenomena should be consistent across all scientific disciplines. B. The simplest and most logical explanation for a phenomenon should be investigated first. C. Behavior should be explained by focusing on internal mental states rather than environmental events. D. Behavior analysis should always seek to find the most complex interventions for challenging behaviors. Answer: B. The simplest and most logical explanation for a phenomenon should be investigated first. This question assesses your understanding of the philosophical assumptions of behavior analysis, specifically parsimony. The principle of parsimony, also known as Occam's razor, states that when multiple explanations for a phenomenon are possible, the simplest explanation that fits the fact should be investigated first. This guiding principle helps behavior analysts avoid overly complex or convoluted explanations for behavior, encouraging them to look for straightforward, environmentally based reasons. For example, before assuming a child's biting is due to an underlying medical condition, a behavior analyst would first explore environmental triggers like attention or escape. Remember, parsimony guides us to look for the most straightforward explanation first. Question 22. A BCBA is teaching a client to follow multi-step instructions. They provide the instruction, go to the door, open it, and close it. The client performs the first step, then the BCBA prompts the second, and so on. They reinforce completion of the entire chain. This describes which type of chaining? A. Forward chaining. B. Backward chaining. C. Total task chaining. D. Behavior chain interruption strategy. Answer: C. Total task chaining. This question tests your knowledge of different chaining procedures. The phrase performs the first step, then the BCBA prompts the second, and so on. They reinforce completion of the entire chain indicates that the learner is prompted through all steps of the chain in every teaching trial, and reinforcement is provided upon completion of the entire sequence. Total task chaining is a method where all steps of a behavior chain are taught during each instructional trial, with prompts provided as needed for any unmastered steps, and reinforcement delivered upon successful completion of the entire chain. In contrast, forward chaining teaches the first step first, and backward chaining teaches the last step first. Total task is like doing the whole dance from start to finish, with help where needed. Question 23. A child engages in self-injurious behavior, SIB, by hitting their head. A functional assessment reveals the SIB is automatically maintained. Which intervention strategy would be most appropriate? A. Providing attention every time the child hits their head. B. Blocking the head hitting and providing a preferred sensory item immediately. C. Removing a preferred item every time the child hits their head. D. Requiring the child to complete a difficult task after hitting their head. Answer: B. Blocking the head hitting and providing a preferred sensory item immediately. This question assesses your ability to select an intervention for automatically maintained behavior. The core clue is automatically maintained, meaning the behavior itself produces reinforcement without social mediation. For automatically maintained SIB, response blocking, physically preventing the behavior, combined with providing a competing, functionally equivalent response, like a preferred sensory item, is often an effective strategy. This provides an alternative way to get the sensory input or stimulation that maintains the SIB. For example, if a child picks at their skin for sensory input, giving them a fidget toy might reduce the picking. The goal is to provide the same sensory experience in a safer way. Question 24. Which of the following is an example of an unconditioned punisher? A. A verbal reprimand. B. A loud noise. C. Loss of privileges. D. A fine for speeding. Answer: B. A loud noise. This question tests your understanding of unconditioned punishers. An unconditioned punisher is a stimulus that decreases the future probability of a behavior without any prior learning or pairing because it is inherently aversive. Loud noises are generally aversive to most organisms without needing to be taught. Verbal reprimands, loss of privileges, and fines are all conditioned punishers, meaning they acquired their punishing properties through learning and association with other punishers. Think of unconditioned punishers as things that are naturally uncomfortable or painful, universally. Question 25. A BCBA is working with a client who frequently screams. The BCBA records every instance of screaming during a 30-minute observation period. What type of measurement is the BCBA using? A. Duration. B. Latency. C. Frequency. D. Interresponse time, IRT. Answer: C. Frequency. This question assesses your understanding of frequency as a dimension of behavior measurement. The key phrase records every instance of screaming indicates that the BCBA is counting how many times the behavior occurs within a specific time period. Frequency, also known as count, is simply the number of times a behavior occurs. Duration measures how long a behavior lasts, latency measures the time before a behavior starts, and IRT measures the time between behaviors. For example, counting how many times a student raises their hand in class is a frequency measure. Frequency is a straightforward way to track repeatable behaviors. Question 26. A token economy system is being used in a classroom. A student earns tokens for completing assignments and can exchange them later for preferred items or activities. The tokens in this system serve as what? A. Unconditioned reinforcers. B. Conditioned reinforcers. C. Punishers. D. Discriminative stimuli. Answer: B. Conditioned reinforcers. This question tests your knowledge of conditioned reinforcers within a token economy. The phrase earns tokens and can exchange them later for preferred items indicates that the tokens themselves are not inherently reinforcing but gain their reinforcing properties through association with other primary or unconditioned reinforcers, the preferred items. Conditioned reinforcers are stimuli that acquire their reinforcing properties through pairing with unconditioned or other conditioned reinforcers. Money is a common example of a conditioned reinforcer in the real world. Remember, a conditioned reinforcer is a learned reward. Question 27. What is the primary ethical concern when implementing a punishment procedure? A. That it might not be effective. B. That it could harm the client or lead to negative side effects. C. That it requires too much staff training. D. That it is too difficult to measure. Answer: B. That it could harm the client or lead to negative side effects. This question focuses on the ethical considerations surrounding punishment procedures. The primary ethical concern with punishment is its potential for harm, including physical or psychological discomfort, aggression, emotional reactions, or generalized suppression of behavior. Behavior analysts are ethically bound to prioritize beneficence and non-maleficence, doing good and doing no harm, and to use the least restrictive, most effective procedures. For this reason, Punishment procedures are typically considered only after less intrusive interventions have been attempted or when behaviors pose significant danger. Always remember to prioritize client safety and well-being above all else. Question 28. A BCBA wants to increase a child's independent play. They provide praise and access to a favorite toy every 5 minutes, regardless of what the child is doing. This schedule of reinforcement is called A. Fixed ratio, FR. B. Variable interval, 6. C. Fixed interval, FI. D. Non-contingent reinforcement, NCR. Answer, D. Non-contingent reinforcement, NCR. This question assesses your understanding of non-contingent reinforcement, NCR. The key clue is regardless of what the child is doing, meaning the reinforcement is delivered on a fixed time schedule, independent of any specific behavior occurring. Non-contingent reinforcement involves delivering a reinforcer on a fixed time, FT, or variable time, VT, schedule, irrespective of the client's behavior. This procedure is often used to reduce problem behaviors by satiating the client with the reinforcer thought to maintain the problem behavior, thus reducing the motivation for it. For example, if a child typically yells for attention, providing attention every few minutes even when they are quiet might reduce the yelling. NCR aims to reduce the motivation for a behavior by giving access to the reinforcer for free. Question 29. A behavior analyst is conducting an assessment and observes that a client's hitting behavior consistently occurs when a demand is placed, and immediately stops when the demand is removed. This suggests the hitting behavior is likely maintained by A. Attention. B. Tangibles. C. Escape. D. Automatic reinforcement. Answer, C. Escape. This question tests your ability to infer a behavior's function from observational data. The key clues are consistently occurs when a demand is placed and immediately stops when the demand is removed. This pattern strongly indicates that the behavior is occurring to terminate or avoid an aversive stimulus, the demand, which is the definition of an escape function. If it were attention, the behavior would increase when attention was provided. If tangibles, it would increase when a desired item was present or removed. For instance, a child might drop to the floor, escape behavior, every time they are asked to clean up toys, and then immediately stand up when the request is withdrawn. This is classic escape-maintained behavior. Question 30. Which of the following is an example of an intraverbal? A. A child saying car when seeing a car. B. A child saying want cookie when wanting a cookie. C. A child saying row 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 your boat after someone says row 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 your. D. A child saying dog when someone asks, what animal barks? Answer, D. A child saying dog when someone asks, what animal barks? This question assesses your understanding of the intraverbal, a type of verbal operant. An intraverbal is a verbal response to another's verbal behavior, where there is no point-to-point correspondence or formal similarity between the stimulus and the response. The question, what animal barks, is a verbal stimulus, and dog is a related verbal response that does not mimic the original stimulus. Option A is attacked, naming, option B is amand, requesting, and option C is an echoic, repeating. Intraverbals are essential for conversations and answering questions. Question 31. A BCBA is teaching a child to imitate actions. They provide a prompt, do this, and model clapping hands. The child claps their hands. This is an example of which type of prompt? A. Verbal prompt. B. Gestural prompt. C. Model prompt. D. Physical prompt. Answer: C. Model prompt. This question tests your knowledge of prompt types used in teaching. The key phrase, model clapping hands, indicates that the therapist is demonstrating the exact behavior they want the child to perform. A model prompt is when the instructor performs the target behavior for the learner to imitate. This is particularly useful for teaching imitation skills, as the prompt itself is the behavior to be learned. A verbal prompt would be saying clap, a gestural prompt would be pointing, and a physical prompt would be physically guiding the hands. Remember, a model prompt is simply showing the learner exactly what to do. Question 32. Which of the following best defines a conditioned reinforcer? A. A stimulus that increases the future probability of a behavior without prior learning. B. A stimulus that decreases the future probability of a behavior without prior learning. C. A previously neutral stimulus that acquires reinforcing properties through pairing with an unconditioned reinforcer. D. A stimulus that always decreases the future probability of a behavior. Answer: C. A previously neutral stimulus that acquires reinforcing properties through pairing with an unconditioned reinforcer. This question focuses on the definition of a conditioned reinforcer. The crucial elements are that it was previously neutral and gained its reinforcing power through pairing with an unconditioned reinforcer. A conditioned reinforcer, often called a secondary reinforcer, is learned. For example, a good job or a token initially means nothing to a child, but after being repeatedly paired with access to a preferred toy or snack, it becomes reinforcing on its own. Option A describes an unconditioned reinforcer, and options B and D describe punishers. Remember, conditioned means learned, and that applies to reinforcers too. Question 33. A BCBA observes a new RBT frequently forgetting to collect data during sessions. To improve the RBT's data collection, the BCBA decides to give the RBT a special data collection checklist to use before, during, and after sessions. This is an example of what type of intervention? A. Response cost. B. Antecedent manipulation. C. Positive punishment. D. Extinction. Answer: B. Antecedent manipulation. This question assesses your understanding of antecedent interventions. The key clue is that the data collection checklist is provided before the behavior, forgetting to collect data, occurs, aiming to make the correct behavior, collecting data, more likely. Antecedent manipulation involves changing events or conditions in the environment that occur before a behavior to increase the likelihood of desired behaviors or decrease the likelihood of challenging behaviors. Providing a checklist serves as a prompt or reminder, setting the occasion for correct data collection. For instance, preparing a healthy snack in advance to avoid unhealthy choices is another form of antecedent manipulation. The goal is to proactively set up the environment for success. Question 34. What is the primary difference between a reinforcer and a punisher? A. A reinforcer increases behavior, while a punisher decreases behavior. B. A reinforcer is always pleasant, while a punisher is always unpleasant. C. A reinforcer is given after a behavior, while a punisher is given before a behavior. D. Reinforcers are for good behaviors, and punishers are for bad behaviors. Answer: A. A reinforcer increases behavior, while a punisher decreases behavior. This question tests a fundamental distinction in operant conditioning. The defining characteristic that differentiates a reinforcer from a punisher is their effect on future behavior. Reinforcers, both positive and negative, increase the future probability of the behavior they follow, while punishers, both positive and negative, decrease the future probability of the behavior they follow. Whether something is pleasant or unpleasant is subjective and not the defining factor. The effect on behavior is the critical element. For example, if saying please leads to getting a cookie, and you say please more often, the cookie is a reinforcer. If saying please leads to a timeout, and you say please less often, the timeout is a punisher. Focus on the outcome on behavior. Question 35. A BCBA is conducting a preference assessment using a paired stimulus, forced choice, method. If a client consistently chooses item A when paired with item B, and item A when paired with item C, but item C when paired with item B, what can be concluded about the preference hierarchy? A. Item B is the most preferred. B. Item C is the most preferred. C. Item A is the most preferred. D. No clear preference hierarchy can be established. Answer: C. Item A is the most preferred. This question assesses your ability to interpret results from a paired stimulus preference assessment. In a paired stimulus assessment, items are presented in pairs, and the client chooses one. The item chosen most often across all pairings is considered the most preferred. If item A is chosen over B and over C, then A is at the top of the hierarchy. If C is chosen over B, then C is preferred over B. Thus, the hierarchy is A greater than C greater than B. This assessment method is useful for identifying a clear rank order of preferences. Always track which item is chosen over others to build the preference hierarchy. Question 36. A BCBA receives a subpoena to release confidential client records. Which ethical guideline is most relevant to the BCBA's response? A. Professional competence and scope of practice. B. Maintaining professional boundaries. C. Protecting confidentiality. D. Responsible conduct of behavior analysts. Answer: C. Protecting confidentiality. This question directly addresses a common ethical dilemma related to client information. The core issue is the release of confidential client records. Behavior analysts have a strict ethical obligation to protect client confidentiality. While a subpoena may legally compel disclosure, the BCBA must ensure they respond in a way that minimizes the disclosure of private information and follows legal and ethical guidelines, often by consulting with legal counsel. For example, they may seek to release only the necessary information or challenge the subpoena if inappropriate. Remember, confidentiality is paramount, and even legal requests require careful, ethical handling. Question 37. Which of the following is the most appropriate behavioral definition for aggression? A. The client was mad and hit the therapist. B. The client hit the therapist, causing a red mark. C. The client showed anger and frustration. D. The client engaged in defiant behavior towards the therapist. Answer: B. The client hit the therapist, causing a red mark. This question tests your understanding of operational definitions in ABA. A good behavioral definition must be objective, clear, and complete, focusing on observable and measurable actions. The client hit the therapist, causing a red mark is observable and measurable. Option A uses internal states, mad, option C describes emotions, anger and frustration, and option D uses subjective terms, defiant behavior, that are not directly observable actions. A good definition allows anyone to reliably identify the behavior when it occurs. For instance, instead of disruptive, a good definition might be client shouted loudly, interrupting the speaker. Always aim for definitions that describe what you can see and hear. Question 38. A child typically makes eye contact with a therapist when the therapist says "look at me," and then receives a high five. If the therapist says "look at me," but doesn't make eye contact themselves, and the child still looks at the therapist's eyes, this indicates the child's response is under A. Manned control, B. Echoic control, C. Stimulus control, D. Automatic control. Answer: C. Stimulus control. This question assesses your understanding of stimulus control. The core concept here is that the child's behavior, making eye contact, consistently occurs in the presence of a specific stimulus, the therapist's verbal instruction "look at me," and not in its absence. Stimulus control occurs when the rate, latency, duration, or amplitude of a response is altered in the presence of a specific stimulus. The fact that the child still responds correctly even when the therapist doesn't make eye contact themselves shows the instruction itself is the controlling stimulus, not just the therapist's eye movement. For example, a dog sitting only when told sit shows stimulus control. When a behavior reliably happens only in the presence of a specific cue, it's under stimulus control. Question 39. Which of the following scenarios describes a contingency-shaped behavior? A. A student follows a list of steps to assemble a model airplane. B. A person stops touching a hot stove after experiencing pain from touching it. C. An employee completes a complex task by reading and following a detailed manual. D. A driver knows to stop at a red light because they were taught the rule. Answer: B. A person stops touching a hot stove after experiencing pain from touching it. This question differentiates between contingency-shaped and rule-governed behavior. Contingency-shaped behavior is learned through direct experience with consequences, meaning the behavior changes due to the immediate, direct contact with reinforcement or punishment. Touching a hot stove and getting burned is a direct consequence that immediately shapes the future behavior of avoiding the stove. The other options involve following instructions, rules, or manuals, which are examples of rule-governed behavior where the behavior is controlled by verbal statements rather than direct experience with contingencies. When behavior changes because of what actually happens right after it, that's contingency-shaped. Question 40. A BCBA implements a new intervention. To ensure treatment fidelity, what is the most important step for the BCBA to take? A. Observe the client's behavior during the intervention. B. Train the implementers, example RBTs, parents, on the exact steps of the intervention. C. Collect baseline data before starting the intervention. D. Conduct a preference assessment with the client. Answer: B. Train the implementers, example RBTs, parents, on the exact steps of the intervention. This question focuses on treatment fidelity, also known as procedural integrity. The most important step to ensure treatment fidelity is to train those implementing the intervention to perform it consistently and accurately as planned. If the intervention is not implemented correctly, its effectiveness cannot be reliably determined. Observing client behavior is important for measuring outcomes, baseline data is for comparison, and preference assessments inform reinforcer selection, but none directly ensure the intervention itself is being delivered correctly. For example, if a recipe calls for specific ingredients and steps, training the cook on those exact details ensures the meal comes out as intended. Fidelity means doing it right, every time. Question 41. A child repeatedly engages in hand flapping. The BCBA observes this behavior occurs most often when the child is alone and not engaged in any activities. This suggests the behavior might be maintained by A. Attention, B. Tangibles, C. Escape, D. Automatic reinforcement. Answer: D. Automatic reinforcement. This question asks you to infer a behavior's function from observational data. The clue occurs most often when the child is alone and not engaged in any activities is critical. This pattern suggests the behavior is producing its own consequence without the mediation of another person or the environment, which is characteristic of automatic reinforcement. If it were attention, it would increase when others were present and paying attention. If it were tangibles or escape, it would be contingent on access to items or demands. For example, humming to oneself when bored is often an automatically reinforced behavior. When a behavior happens even when no one else is around or no specific demands are placed, think automatic. Question 42. When conducting a behavioral assessment, which of the following is an example of an indirect assessment method? A. Direct observation of the client's behavior in their natural environment. B. Conducting a functional analysis by manipulating environmental variables. C. Interviewing parents and teachers about the client's challenging behaviors. D. Taking ABC data during a therapy session. Answer: C. Interviewing parents and teachers about the client's challenging behaviors. This question tests your understanding of different behavioral assessment methods. The key term is indirect assessment, which refers to gathering information about behavior through interviews, questionnaires, or rating scales, rather than directly observing the behavior as it occurs. Options A, B, and D are all forms of direct assessment or functional analysis, which involve direct observation and manipulation. For instance, asking a client about their past experiences with anxiety is an indirect assessment. Indirect methods are useful for gathering initial information but should be supplemented with direct observation for a complete picture. Question 43. A BCBA is teaching a child to say thank you. Initially, they reinforce any approximation like th, then thank you. This process is an example of A. Chaining, B. Shaping, C. Discrimination training, D. Fading. Answer: B. Shaping. This question assesses your knowledge of shaping. The scenario describes reinforcing any approximation that gets closer to the target vocalization thank you. Shaping involves reinforcing successive approximations of a target behavior until the full behavior is emitted. It's used when the target behavior is not initially in the learner's repertoire. Chaining involves linking existing behaviors together. Discrimination training teaches to respond differently to different stimuli, and fading involves gradually removing prompts. For example, teaching a child to say water might start by reinforcing wa, then wah, then water. Shaping is how new behaviors are taught by building on small steps. Question 44. Which type of discontinuous measurement involves recording whether a behavior occurred at any point during a specific interval? A. Momentary time sampling. B. Partial interval recording. C. Whole interval recording. D. Frequency recording. Answer: B. Partial interval recording. This question tests your knowledge of discontinuous measurement procedures. The definition, recording whether a behavior occurred at any point during a specific interval, precisely describes partial interval recording. With partial interval recording, if the behavior happens even for a second within the interval, you mark it as having occurred. Momentary time sampling records if the behavior is happening at the end of the interval, and whole interval recording records if the behavior occurred throughout the entire interval. Frequency recording is a continuous measurement. For example, if you're tracking fidgeting in 1-minute intervals, and the child fidgets for 5 seconds within a minute, you mark it as occurring for that minute using partial interval recording. It often overestimates high-frequency behaviors. Question 45. A BCBA creates a social story for a client to read before going to the dentist, describing what will happen during the visit. This is an example of what type of antecedent intervention? A. Non-contingent reinforcement. B. High probability request sequence. C. Priming. D. Differential reinforcement. Answer: C. Priming. This question assesses your understanding of priming as an antecedent intervention. The key clue is that the social story is presented before the potentially challenging event, going to the dentist, to prepare the client for what is to come. Priming involves pre-exposing a learner to information, activities, or materials that they will encounter later, with the goal of increasing the likelihood of successful participation and reducing problem behaviors. Non-contingent reinforcement delivers reinforcers on a fixed time. High-probability request sequences involve presenting easy tasks first, and differential reinforcement involves reinforcing specific behaviors. Priming helps set the stage for success by preparing the individual for upcoming events. Question 46. What is the main purpose of Interobserver Agreement, IOA, in ABA? A. To determine if the intervention is effective. B. To assess the reliability and consistency of data collection. C. To identify the function of a challenging behavior. D. To measure the client's preference for reinforcers. Answer: B. To assess the reliability and consistency of data collection. This question focuses on the purpose of Interobserver Agreement, IOA. The core concept of IOA is to ensure that behavioral data are trustworthy and accurately reflect the client's behavior. IOA is calculated by having two or more independent observers simultaneously collect data on the same behavior and then comparing their recordings. High IOA indicates that the definition of the behavior is clear and that observers are reliably and consistently identifying its occurrence, making the data more credible. For example, if two different therapists count the same number of times a child screams, it shows their measurement is reliable. IOA helps confirm that you're measuring the behavior consistently. Question 47. A child typically engages in hand-mouthing. The BCBA designs an intervention where every time the child's hands are in their mouth, a preferred toy is immediately removed for 15 seconds. This is an example of A. Positive punishment. B. Negative punishment. C. Extinction. D. Response blocking. Answer: B. Negative punishment. This question tests your understanding of negative punishment. The key components are the removal of a preferred stimulus. Preferred toy is immediately removed. Following the behavior, hands are in their mouth, with the intent to decrease the future probability of that behavior. Negative punishment involves taking away something desirable contingent on a behavior, to reduce that behavior. Positive punishment adds something aversive, and extinction withholds reinforcement. Response blocking physically prevents the behavior. For example, if a child draws on the wall and their favorite crayons are taken away, that is negative punishment aimed at reducing drawing on the wall. Remember, negative means taking something away. Question 48. What is the primary difference between a discriminative stimulus, SD, and an S-delta? A. An SD signals the availability of reinforcement, while an S-delta signals the absence of reinforcement. B. An SD decreases behavior, while an S-delta increases behavior. C. An SD is always a verbal cue, while an S-delta is always a nonverbal cue. D. An SD is a punisher, while an S-delta is a reinforcer. Answer: A. An SD signals the availability of reinforcement, while an S delta signals the absence of reinforcement. This question assesses your understanding of stimulus control, specifically the roles of SDs and S deltas. An SD, discriminative stimulus, is a stimulus in the presence of which a particular response is reinforced. An S delta is a stimulus in the presence of which that same response is not reinforced. For example, a stop sign, SD, signals that pressing the brake will be reinforced by safety, while a go sign, S delta for stopping, signals that pressing the brake will not be reinforced in that context. The presence of an SD makes a behavior more likely, while an S delta makes it less likely, but not necessarily because of punishment, but because reinforcement is unavailable. Question 49. A BCBA is teaching a client to sort objects by color. They use physical prompts to guide the client's hand to the correct pile, then gradually reduce the amount of physical assistance over time. This process of gradually reducing prompt dependence is called A. Chaining, B. Shaping, C. Prompt fading, D. Stimulus fading. Answer, C. Prompt fading. This question tests your knowledge of prompt fading, a common teaching strategy. The key phrase, gradually reduce the amount of physical assistance, clearly describes the process of prompt fading. Prompt fading involves systematically reducing the strength or intrusiveness of a prompt over time to transfer stimulus control from the prompt to the natural discriminative stimulus. This helps ensure the learner doesn't become overly reliant on prompts. In contrast, stimulus fading involves gradually changing the stimulus itself. For example, slowly making a picture prompt smaller until the child responds only to the verbal instruction is prompt fading. Prompt fading is crucial for fostering independence. Question 50. A BCBA is conducting a preference assessment using a single stimulus, successive choice, method. How would this method typically be implemented? A. Presenting two items simultaneously and recording the client's choice. B. Presenting one item at a time and recording whether the client approaches or interacts with it. C. Allowing free access to multiple items and observing which ones the client interacts with. D. Presenting multiple items and removing chosen items after each selection. Answer, B. Presenting one item at a time and recording whether the client approaches or interacts with it. This question assesses your understanding of the single stimulus, successive choice, preference assessment method. The core of this method is one item at a time. In a single stimulus assessment, individual items are presented to the client one by one, and the therapist records whether the client engages with the item and for how long. This method is often used for clients who have difficulty making choices between multiple items. Paired stimulus presents two, free operant allows free access to many, and MSWO presents many and removes chosen items. This method simply presents items individually to see if they are engaging. Question 51. A BCBA is teaching a child to tie their shoes. They decide to teach the last step first, pulling the loops tight, then the second to last step and the last step, and so on, until the child can tie their shoes independently. This is an example of what type of chaining? A. Forward chaining. B. Backward chaining. C. Total task chaining. D. Behavior chain interruption strategy. Answer, B. Backward chaining. This question tests your knowledge of backward chaining. The key clue is teach the last step first, followed by then the second to last step and the last step. In backward chaining, the learner is prompted through all steps of the chain except for the last one, which they are taught to perform independently. Once the last step is mastered, the second to last step is taught, and so on, with reinforcement provided upon completion of the entire chain. This method is often preferred as the learner always experiences success and reinforcement at the completion of the chain. For example, teaching a child to wash hands might start by just having them turn off the water, then drying, then rinsing, etc., always ending with the successful last step. Question 52. Which of the following best defines an echoic verbal operant? A. Saying cookie because you want a cookie. B. Saying ball when you see a ball. C. Saying red when asked what color is a stop sign. D. Saying cup immediately after someone else says cup. Answer: D. Saying cup immediately after someone else says cup. This question assesses your understanding of the echoic verbal operant. An echoic is a verbal response that has point-to-point correspondence and formal similarity with a vocal verbal stimulus. In simpler terms, it's repeating what someone else said. Option A is a mand, option B is a tact, and option C is an intraverbal. Echoics are important for developing vocal imitation and acquiring new verbal skills. For example, a therapist says airplane, and the child repeats airplane, which is an echoic. It's simply vocal imitation. Question 53. A BCBA observes a client hitting their head when they are alone in the room. The BCBA designs an intervention where a sensory toy is given to the client on a fixed-time 2-minute schedule, regardless of whether the client hits their head. This intervention is an example of A. Differential reinforcement of alternative behavior, DRA. B. Non-contingent reinforcement, NCR. C. Differential reinforcement of other behavior, DRO. D. Response cost. Answer: B. Non-contingent reinforcement, NCR. This question tests your understanding of non-contingent reinforcement, NCR. The key clue is given to the client on a fixed-time 2-minute schedule, regardless of whether the client hits their head. NCR involves delivering a reinforcer on a fixed or variable time schedule, independent of the challenging behavior. This strategy aims to reduce problem behavior by providing the suspected reinforcer for free, thereby decreasing the motivation to engage in the problem behavior. If the hitting is automatically maintained, providing a sensory toy non-contingently might reduce the need to engage in SIB to get that sensory input. This method seeks to prevent the problem behavior by making the maintaining reinforcer freely available. Question 54. What is the primary purpose of conducting a skills assessment, example ABLLSR, VB-MAP, for a client? A. To identify the function of challenging behaviors. B. To determine a client's preference for reinforcers. C. To identify a client's current strengths and areas of skill deficits. D. To measure the effectiveness of a specific intervention. Answer: C. To identify a client's current strengths and areas of skill deficits. This question focuses on the primary purpose of skills assessments. The names ABLLSR and VB-MAP are clues that these are standardized tools designed to evaluate a learner's abilities across various domains, such as language, social skills, and daily living skills. A skills assessment aims to pinpoint what a client can already do well, strengths, and what skills they need to learn, deficits, which then informs the development of individualized teaching programs. Functional assessments identify behavior functions, preference assessments identify motivators, and measuring intervention effectiveness comes after skills are targeted. Skills assessments are like a roadmap for teaching. Question 55. A BCBA is explaining the principles of ABA to a new family. They explain that behavior is determined by environmental events and is not random. Which philosophical assumption of ABA is being described? A. Empiricism. B. Determinism. C. Parsimony. D. Pragmatism. Answer: B. Determinism. This question assesses your understanding of the philosophical assumptions underlying ABA. The statement "behavior is determined by environmental events and is not random" directly defines determinism. Determinism is the assumption that all events, including behavior, are the result of specific antecedent and consequent environmental factors, and are thus lawful and predictable. Empiricism emphasizes objective observation, parsimony favors simpler explanations, and pragmatism focuses on practical results. For instance, if a child cries every time a loud noise occurs, determinism suggests there's a reason, not just random crying. It's the belief that behavior happens for a reason, and we can find that reason. Question 56. What is the most important ethical consideration when developing a behavior intervention plan, BIP? A. Ensuring it is easy for all staff to implement. B. Prioritizing the client's dignity and rights. C. Only using positive reinforcement procedures. D. Making sure it can be implemented quickly. Answer: B. Prioritizing the client's dignity and rights. This question targets the ethical foundation of intervention planning. While all options have some relevance, prioritizing the client's dignity and rights is the paramount ethical consideration when developing any behavior plan. This includes ensuring informed consent, using the least restrictive effective procedures, respecting cultural differences, and always acting in the client's best interest. Effectiveness and ease of implementation are important but secondary to the client's fundamental rights and well-being. For example, a plan should never use a highly intrusive intervention if a less intrusive, equally effective one is available, respecting the client's right to self-determination. Always put the client's well-being and rights first. Question 57. A BCBA is teaching a child to say apple. They present a picture of an apple and ask, "What is this?" The child says apple. The BCBA accepts this response and provides reinforcement. This is an example of what? A. Prompt fading. B. Shaping. C. Loose training. D. Reinforcement for an approximation. Answer: D. Reinforcement for an approximation. This question assesses your understanding of how approximations are handled in teaching. When the child says apple instead of apple, it's not the full target behavior but is a close enough approximation that the BCBA chooses to reinforce it. This is a common part of shaping or early acquisition when a perfect response isn't yet expected. While it's part of the broader concept of shaping, the specific action of reinforcing the apple sound is reinforcing an approximation. Prompt fading reduces prompts, shaping builds new behaviors gradually, and loose training varies teaching stimuli. Here, the immediate focus is on accepting and reinforcing a close enough attempt. Question 58. A BCBA is tracking the time between a client completing one math problem and starting the next math problem. What dimension of behavior is the BCBA measuring? A. Duration. B. Latency. C. Frequency. D. Interresponse time, IRT. Answer: D. Interresponse time, IRT. This question tests your understanding of interresponse time, IRT, as a dimension of behavior measurement. The key phrase "time between a client completing one math problem and starting the next math problem" precisely defines IRT. IRT is the time elapsed between two consecutive instances of the same behavior. Duration measures how long a single behavior lasts, latency measures the time from a stimulus to the start of a response, and frequency is simply the count. For example, if a child finishes one bite of food and waits 10 seconds before taking the next bite, that 10 seconds is the IRT. IRT helps understand the pacing of behaviors. Question 59. A BCBA is designing a treatment plan for a child with limited vocalizations. To increase the child's vocal imitation, which verbal operant should the BCBA prioritize teaching first? A. Mand. B. Tact. C. Echoic. D. Intraverbal. Answer C. Echoic. This question assesses your understanding of the typical sequence of teaching verbal operants, especially for children with limited vocal skills. The key phrase, increase the child's vocal imitation, directly points to the echoic operant. Echoics, or vocal imitations, are often taught first because they establish a foundational skill for learning other verbal operants. Once a child can echo sounds and words, they can then more easily be taught to mand, tact, and engage in intraverbals. For example, if a child can repeat ball after you say it, you can then teach them to mand for ball or tact ball when they see one. Teaching echoics provides the building blocks for more complex language. Question 60. What is the ethical responsibility of a BCBA regarding client records if they decide to close their private practice? A. Shred all records immediately to ensure confidentiality. B. Transfer records to the client's new provider without consent. C. Retain records for a specified period and ensure secure storage. D. Give all records to the client or their legal guardian for safekeeping. Answer C. Retain records for a specified period and ensure secure storage. This question tests your knowledge of ethical guidelines related to record keeping. Behavior analysts have an ethical obligation to retain client records for a specific period, as determined by law or agency policy, typically 7 years, and to ensure their secure storage, even after services conclude or a practice closes. Shredding immediately is inappropriate, transferring without consent is unethical, and simply giving records to the client might not meet legal or ethical retention requirements for the practitioner. For example, a medical office doesn't immediately discard patient files when a doctor retires. This ensures continuity of care and legal compliance. Question 61. A BCBA teaches a client to request a break by saying break, please when overwhelmed. The BCBA then ensures that no other way of requesting a break, example flopping to the floor, works. This is an example of what? A. High probability request sequence. B. Stimulus fading. C. Contingency contracting. D. Differential reinforcement. Answer D. Differential reinforcement. This question tests your understanding of differential reinforcement. The core of the strategy is to reinforce one behavior, saying break, please, while not reinforcing other behaviors, flopping to the floor, that serve the same function. Differential reinforcement is a procedure in which one form of a behavior is reinforced, and all other forms of the behavior are not reinforced. This approach strengthens the desired behavior while weakening the undesired behavior. For instance, if a child screams for attention, you might only give attention when they tap your shoulder, not when they scream. Differential reinforcement is a powerful way to shift behavior towards more appropriate forms. Question 62. A client screams whenever they are asked to complete a task. The BCBA uses a first-then board, showing first, work, then, play, before presenting tasks. This is an example of A. Positive punishment. B. Negative reinforcement. C. Antecedent manipulation. D. Response cost. Answer: C. Antecedent manipulation. This question assesses your understanding of antecedent interventions. The first-then board is used before the task is presented, aiming to make the task more predictable and to signal the availability of a reinforcer for completing the task, thereby preventing or reducing the screaming behavior. Antecedent manipulation involves altering environmental variables before a behavior occurs to change the likelihood of the behavior. It sets the stage for appropriate behavior. For example, providing a visual schedule to a child before starting their day is another form of antecedent manipulation. These strategies are proactive ways to prevent problem behavior. Question 63. Which of the following is the best example of a motivating operation, MO? A. A child being told, if you clean your room, you can play video games. B. A child becoming very thirsty after eating salty popcorn, making water a more effective reinforcer. C. A child receiving a token for completing a task. D. A child engaging in hand flapping in the absence of demands. Answer: B. A child becoming very thirsty after eating salty popcorn, making water a more effective reinforcer. This question tests your understanding of a motivating operation, MO. An MO is an environmental variable that temporarily alters the effectiveness of a stimulus as a reinforcer or punisher, and alters the frequency of behavior that has been reinforced or punished by that stimulus. Eating salty popcorn makes water more valuable, an establishing operation for water as a reinforcer, and increases the likelihood of behaviors that result in water. Option A is a rule, option C is a conditioned reinforcer, and option D describes an automatically reinforced behavior. An MO changes how much you want something and how likely you are to work for it. Question 64. A BCBA records whether a client is engaging in on-task behavior for the entire 10-minute interval. If the client was off-task for even 1 minute during that interval, it is not marked as on-task. What type of measurement is this? A. Momentary time sampling. B. Partial interval recording. C. Whole interval recording. D. Frequency recording. Answer: C. Whole interval recording. This question assesses your understanding of whole interval recording. The key phrase is engaging in on-task behavior for the entire 10-minute interval, and if the client was off-task for even 1 minute, it is not marked as on-task. Whole interval recording requires the behavior to occur continuously throughout the entire interval for it to be recorded. It often underestimates the true occurrence of behavior, especially if it occurs intermittently. Momentary time sampling checks at the end of an interval, and partial interval checks at any point. Whole interval is good for behaviors you want to increase and are continuous, like sustained attention. Question 65. A BCBA creates a written list of steps for a client to follow when preparing a sandwich. 1. Get bread. 2. Get peanut butter. 3. Get jelly, etc. This is an example of what? A. Shaping. B. Chaining. C. Task analysis. D. Prompting. Answer: C. Task analysis. This question tests your understanding of a task analysis. A task analysis involves breaking down a complex skill, like making a sandwich, into smaller, sequential, and teachable steps. This written list is a direct representation of a task analysis. Once the task analysis is complete, a chaining procedure, forward, backward, or total task, would be used to teach the steps. Shaping builds a single new behavior, and prompting provides cues. A task analysis is the process of identifying the steps, not the teaching method itself. It's like writing out the recipe before you start cooking. Question 66. A child is learning to identify different emotions. The therapist shows a picture of a happy face and asks, "What is this?" The child says happy. This is an example of what type of verbal operant? A. Mand. B. Tact. C. Echoic. D. Intraverbal. Answer B. Tact. This question assesses your knowledge of the tact verbal operant. The key is that the child is responding to a picture of a happy face, which is a nonverbal stimulus in the environment. A tact involves labeling or naming something observed in the environment, evoked by a nonverbal stimulus, and is maintained by generalized conditioned reinforcement. If the child was asking for a happy face, Mand, repeating a verbal instruction, echoic, or answering a question without the picture present, intraverbal, it would be different. A tact is like labeling the world around you. Question 67. A client engages in property destruction. The BCBA designs an intervention where the client must repair the damaged property and then clean up other areas of the room. This procedure is called A. Timeout. B. Overcorrection. C. Response cost. D. Extinction. Answer B. Overcorrection. This question tests your understanding of overcorrection, a form of positive punishment. The intervention requires the client to not only repair the damaged property, restitutional overcorrection, but also clean up other areas of the room, positive practice overcorrection. Overcorrection is a punishment procedure where the individual is required to engage in effortful behavior that is functionally related to the problem behavior, typically consisting of restitutional overcorrection, restoring the environment to a better state than before the problem behavior, and/or positive practice overcorrection, repeatedly practicing a more appropriate behavior. It is often quite effective because it goes beyond simply correcting the error. Question 68. A BCBA has been asked to provide services to a client who lives in a different state. The BCBA has never practiced in that state. What is the most important ethical consideration for the BCBA? A. The BCBA must ensure they are competent and licensed to practice in that state. B. The BCBA should decline services, as long-distance services are always ineffective. C. The BCBA can provide services as long as they follow the ethical guidelines of the BACB. D. The BCBA should only provide indirect services in this situation. Answer A. The BCBA must ensure they are competent and licensed to practice in that state. This question addresses the ethical guideline of professional competence and scope of practice, specifically concerning legal and jurisdictional requirements. Behavior analysts must only provide services within their competence and within the legal and regulatory parameters of the jurisdiction where services are delivered. Practicing in a different state often requires specific licensure or adherence to interstate compacts. Simply following BACB guidelines is not enough if state laws are violated. This is a crucial step to avoid legal and ethical violations and ensure the quality of services. Always verify state-specific requirements before practicing outside your usual jurisdiction. Question 69. A client is learning to follow a visual schedule. The BCBA initially uses a highly preferred picture of a cartoon character for playtime on the schedule. Over time, the BCBA gradually replaces the cartoon character with a generic picture of a toy box, and eventually with just the word play. This is an example of what? A. Prompt fading. B. Shaping. C. Stimulus fading. D. Generalization. Answer: C. Stimulus fading. This question tests your understanding of stimulus fading. The key clue is that the stimulus itself, the picture of playtime, is gradually changed from a highly preferred picture to a generic picture and then to just the word play. Stimulus fading involves gradually changing the form of the stimulus, example its size, color, or other features, or gradually withdrawing it while the response remains unchanged. This is done to ensure the behavior comes under the control of the natural, less intrusive stimulus. Prompt fading involves reducing prompts, not changing the stimulus itself. This ensures the learner responds to the natural cue, not an artificial one. Question 70. What is a key characteristic of applied behavior analysis? A. Focuses on internal mental states to explain behavior. B. Emphasizes the use of highly aversive interventions. C. Focuses on socially significant behaviors in real-world settings. D. Relies primarily on self-report data. Answer: C. Focuses on socially significant behaviors in real-world settings. This question addresses a defining dimension of applied behavior analysis. Applied means that ABA interventions target behaviors that are important and meaningful to the individual and society, and occur in everyday environments. This sets ABA apart from basic research that might study behavior in a lab. ABA does not focus on internal states, that's mentalism. It prioritizes least restrictive interventions, and it relies on direct, observable measurement, not just self-report. For example, teaching a child to communicate their needs effectively is socially significant. ABA is all about making a practical, meaningful difference in people's lives. Question 71. A BCBA implements an intervention and notices an extinction burst. What does an extinction burst typically involve? A. A sudden, significant decrease in the target behavior. B. A temporary increase in the frequency, intensity, or variability of the target behavior. C. The generalization of the target behavior to new settings. D. The spontaneous recovery of a previously extinguished behavior. Answer: B. A temporary increase in the frequency, intensity, or variability of the target behavior. This question assesses your understanding of an extinction burst, a common phenomenon during extinction procedures. An extinction burst is a predictable, temporary increase in the rate, intensity, or variability of a behavior when reinforcement for that behavior is suddenly withheld. It often includes novel behaviors. For example, if a child usually cries for attention and suddenly crying no longer works, they might cry louder, longer, or try new behaviors like stomping before the crying eventually decreases. It's often a sign that the extinction procedure is working, but it can be challenging. Remember, an extinction burst is a temporary spike before the behavior eventually decreases. Question 72. A BCBA needs to graph a client's frequency of hitting over several weeks. What type of graph is most appropriate for displaying this data? A. Bar graph. B. Pie chart. C. Line graph. D. Scatter plot. Answer: C. Line graph. This question tests your knowledge of common data display methods in ABA. A line graph is the most appropriate and widely used type of graph in ABA to display changes in behavior over time, such as frequency across weeks. It allows for clear visualization of trends, stability, and variability. Bar graphs are typically used for comparing discrete sets of data, pie charts for proportions, and scatter plots for showing relationships between two variables. For example, plotting the number of times a child elopes each day on a line graph clearly shows whether the behavior is increasing or decreasing over the days. Line graphs are essential for tracking progress in behavior analysis. Question 73. Which philosophical assumption of ABA states that scientific knowledge should be based on objective observation and measurement, not on personal opinions or feelings? A. Determinism. B. Empiricism. C. Parsimony. D. Pragmatism. Answer: B. Empiricism. This question assesses your understanding of the philosophical assumptions of ABA. The phrase objective observation and measurement, not on personal opinions or feelings, directly describes empiricism. Empiricism is the practice of objective observation and measurement of phenomena of interest. It means that conclusions about behavior must be based on data that can be seen, heard, touched, or measured, making it verifiable and replicable. Determinism is about cause and effect, parsimony is about simplicity, and pragmatism is about practical value. Empiricism is foundational because it ensures that our understanding of behavior is grounded in reality. Question 74. A child is engaging in a tantrum. The BCBA observes that the tantrum immediately stops when the parent picks up the child and cuddles them. Based on this observation, what is the likely function of the tantrum? A. Automatic reinforcement. B. Escape. C. Tangible. D. Social positive reinforcement, attention. Answer: D. Social positive reinforcement, attention. This question tests your ability to identify the function of behavior from an observation. The key clue is that the tantrum immediately stops when the parent picks up the child and cuddles them. Being picked up and cuddled is a form of social attention. Since the tantrum ceased when attention was provided, it suggests the tantrum was maintained by positive reinforcement in the form of attention. If it were escape, the tantrum would stop when a demand was removed. If it were automatic, it would occur when alone. If it were tangible, it would stop when an item was given. This is a classic example of a behavior maintained by social positive reinforcement. Question 75. A BCBA observes that a client's hand-flapping behavior increases when a preferred toy is removed. The BCBA suspects this is an example of what? A. Positive reinforcement. B. Negative reinforcement. C. Extinction burst. D. Evocative effect of an abolishing operation, AO. Answer: D. Evocative effect of an abolishing operation, AO. This question delves into motivating operations, MOs, specifically an abolishing operation, AO. The phrase preferred toy is removed indicates that an item that previously functioned as a reinforcer has been taken away, which would likely act as an abolishing operation for engaging with that toy. When an AO occurs, it decreases the effectiveness of a stimulus as a reinforcer and evokes, makes more likely, behaviors that have historically produced or allowed access to other reinforcers. In this case, the removal of the toy makes the sensory input from hand flapping more valuable and therefore more likely to occur. It's not a punishment or reinforcement effect, but a change in the value of a reinforcer. When something desirable is removed, other behaviors that serve a similar purpose might become more likely.